Association of Physicians of Indian Origin brings to you our first annual conference on the 5th of September 2021, the Global Healthcare Conclave, a unique hybrid conference that one either online or offline as per their comfort. We at GAIMS would like to thank you all for your participation.
I am Pranjala, and today we are here to acknowledge the impact of artificial intelligence in healthcare. Artificial intelligence has transformed industries around the world and has the potential to revolutionize healthcare. Being able to analyze data from patient visits to clinic, as well as assessing prescription drugs, tests, and procedures performed in the laboratory, all can be done via artificial intelligence. Activity logs also provide valuable health information that can transform patient care and diagnosis.
Thank you, Pranjala. Acknowledging the importance of artificial intelligence, let's get to the session we have all been waiting for without any further ado. I am Vishnu, your moderator, and today we are honored to have with us Dr. Arunkumar Annamalai, a medical doctor with multidisciplinary expertise in family medicine, public health, psychiatric epidemiology, machine learning, clinical artificial intelligence, medical devices, and robotics, including wearables, smart clothing, and translational research. Dr. Arun Kumar has also been working on operations research in healthcare with end-to-end knowledge of research and development, including clinical trials and regulatory efforts. He's a specialist in managing, analyzing, and interpreting unstructured clinical data in the form of text, voice, and images, as well as developing and deploying advanced clinical decision support systems. A blockchain technology enthusiast, Sir is also involved in the clinical validation of drugs, diagnostics, vaccines, and informatics. Besides his interest in artificial intelligence, Dr. Arun Kumar is also a linguist with more than 10 years of experience in research into language acquisition and allied sciences. Being a non-academic member of the Board of Studies in the Department of French and Foreign Languages at the University of Madras, Sir is an acclaimed author and keynote speaker. We are honored to have you with us today, sir. The stage is now yours.
Yeah, thank you guys, and thanks Vishnu for that elaborate introduction. And yeah, so I would like to share my screen. Okay, so can you see the screen, Vishnu?
Yes, sir, screen is visible.
Okay. Okay, so today we'll have a very brief session on about the artificial intelligence in healthcare. So two things which we will be doing, and is that we'll get an overview of what AI is and what it can do in healthcare, and what is not covered in this session. We are not going into the technical aspects of it. We are not going to cover any technical jargons. Predominantly the session is targeted for medicos who are actually trying to understand what AI can do for them. So let us get started. So overview of the session will be the total 1 hour, like I've broken down into 40 minutes and 20 minutes. The first 40 minutes will have the session, and the next 20 minutes will have for Q&A. And I believe there'll be more questions, and I want to have a two-way interaction during the Q&A session, so that whatever doubts you people have, I want to take all your questions. And the session is all about the basic concepts of AI in healthcare. Okay, so this session I have split into 3 parts. The first part is the common misconception about AI, and the second part is what can AI really do in healthcare, and the third part is the common question I always get from students and fellow colleagues is that I am a doctor and I want to build an AI, how to proceed? And usually we have a lot of questions. Okay, I don't know coding. Can I still work with an AI? And how much coding should I know? What are the tools should I know? What are the concepts I should learn? Because people who are into clinical practice for 15 or 20 years, they would have last studied math or about technical concepts in their school. So can people who are into clinical practice for 15 years or 20 years can come and learn anything related to AI, or can they really explore AI? Can they work with an AI? So today we'll be answering all the questions. So I have tried to make it as simple as possible so that it's clean and clear and any medico can understand. Yes, let us go to the first question. So the common misconception is that AI will replace doctors. So like we think that no, when AI comes, like people will stop going to a doctor, and which is not true. Let us come to, I'll give you a better explanation on that. So one thing is, AI will help you screen out those patients who really require your time, and probably those people who do not require your time, and AI will see. A simple example is that you go to any outpatient department in a government hospital, maybe a fever clinic, you will be finding some 200 or 300 patients lined up. I'm talking about the pre-COVID time when fever was not a taboo, but today you go, you say fever in a government OPD, you're immediately sent for a COVID-19 test. But before pre-COVID times, in any general medicine clinic, you'll find some 300 to 400 patients lined up. And out of this 300 or 400 patients, the actual patients who really require a physician to intervene will be around 30 to 40, probably 100. So what happens is 100 out of this 400, which is 25% of the population, is what really requires a doctor and his time. The remaining 300 people may not be really requiring a doctor, may not be really requiring a specialist attention. So we are more when an AI comes into play, it is actually going to focus on that 75% of the people who do not really need to see a doctor in the first place. So that is one thing. So what are we really going to do? So AI is not going to steal your job, yes, but it is actually going to steal the job that can be automated. There are a lot of things that a doctor is actually doing which is more clerical and less clinical. They'll be filling out a lot of forms, they'll be pulling out a lot of information. Let us say there is a patient, and the information about the patient has to put inside a database. A doctor has to sit and type, and the patient's clinician's notes, maybe a patient's prescription, a patient's history, or various data from the patient. Especially when you go to psychiatry, the patients will be talking for hours. When you go for therapy and psychotherapies, you'll find patients, especially panic patients, they keep talking to the doctor for hours, where the actual diagnosis takes maybe a few minutes. The actual treatment may not actually happen inside the clinic, but the doctor is actually spending most of his time talking to the patient, or talking to, or maybe collecting data that does not really require a clinician to collect. So what will an AI do? AI will take up the job that can be automated. It will take up the jobs that does not really require physician's intervention. In very simple terms, like how a nursing as a profession came into existence. Florence Nightingale, during the World War, she felt a doctor cannot look at each and every patient, right? Because most of the patients did not really require treatment. Rather, they required care and support, right? They required more empathy. They required more attention. So when it comes to attention, and a doctor seeing 200 or 300 patients a day, the attention that he can give for every patient is around 2 to 3 minutes, right? So that is how, like, Florence Nightingale, she felt that it's better to have a profession that will assist the doctor and help him give better care. So AI in reality will not replace the physician. Rather, it will just assist a doctor, and it'll be more like a screening procedure. There are some 200 patients. It will find out who are those people who really require the doctor, and whom has to be prioritized. Like, you might be having an emergency case sitting at the 10th patient, but a non-emergency case sitting as the first patient. But you put an AI will tell you the patient who's sitting 10th has to go in first. So all this work, all these decisions that cannot be computed by a human brain easily will be taken care by an AI. That's the point number one. Point number two is, even if you have a fully functional AI operating across the world, you still need a real doctor to validate the findings of an AI. Let us say there is a patient who comes, you build an AI that predicts a patient's stroke, or it predict a patient's heart attack, or it reads the ECG, it does an automatic evaluation of various vital parameters, or it suggests doing blood tests, or even suggests treatment. But still, when AI tells this, how do I validate this information? So at any point of time, how much ever the AI becomes fully functional, you still require a doctor to validate it. You need a human being before a human being, and not a machine, right? So coming to the point, there are two things. First thing is, AI will be more like an assistant to a doctor, and doctor will always have an upper hand. And point number two is, a human doctor is always necessary to validate the findings of an AI. So this misconception, so if at all you guys are looking at towards AI, and we have a lot of misconceptions, or can I really adopt it, will it replace my job, will I lose my job? No, it may not really, you may not really lose a job. Probably it will take you in a different direction. Let us see that how it happens. So what will AI really do then? So it will be like the oil or electricity that will push the human civilization to the next level. See, the human beings have been operating, the human civilizations have been operating for thousands of years, right? But in spite of that, and when oil came in, and people started mining oil, people started using oil, and started using oil as a fuel, and the transport industry came into existence, and then flying machines, and now we are going to Mars and landing in moon. But still the humans, so some of the basic things still remain the same, right? But what did oil really do? Oil just changed the way we live. No, the oil just changed the way we operate. No, the human dynamics changed completely. That's the same with electricity. So what happened after the advent of electricity? Probably today, almost everything that is right in front of us is running on electricity. The tube light, the fan, the virtual devices that we are using, everything is working on electricity. The same way, an artificial intelligence will push the human civilization to the next level, and it will not do anything more than that, because we have always seen things in history. Oil did not change the humans. No, it didn't change the basic aspects of a human being. The biologically, genetically, nothing changed. It just changed the way we live. Electricity changed the way we live. The same way an AI will change the way we live, and it will push the human civilization to the next level. Yes. So that brings us to the end of that part one, the misconception. So now, one straightforward question that we always have: can I trust an AI? Yes, please trust an AI. Because, and another thing, AIs are not foolproof. It's like a watch. See, in spite of having watches everywhere, but still your watch can run faster or slower. You still need someone to really validate the time. The same way, if there is an AI, still you need someone to tell whether the AI is right or wrong. Okay. So what are the various applications in healthcare of AI in healthcare? What are the various things that's being explored? And some of the things are already existent, but overall, AI in healthcare, the penetration is very less. The reason is the validation process, and there are a lot of challenges. We'll come to that later. So the penetration of AI in healthcare is very less, and also it's still in the nascent stages. If you compare AI in the banking finance sector, or maybe you compare AI in any other technology, automobile industry, and you compare the AI with the healthcare industry, we are still making the baby steps. So though we have identified potential use cases, we have developed a lot of innovative solutions, but still, if you go to any primary health center, it's still the same. You find the same table, you find the same chair, you find the same doctor, patient, same lined up the same way, the same type of treatment being given, but most of the things didn't change. Yes, maybe for the vaccination today, we have the app where we schedule appointments using the app, but still, when that is just a small speck in the entire universe of an AI. So we're just using a different interface to book appointments. So now what are the common applications of AI in healthcare? Is one thing is the AI assisted robotic. This is not in a particular order, just the terms. So one thing is the AI assisted robotic surgeries. Yes. So how will it help for robotic surgeons? So for you all of us know, like for a surgeon, there is a huge learning curve, right? An orthopedic surgeon who's doing knee replacements or hip replacements, he has a longer learning curve in learning the process. But when an AI assisted robotic surgery comes in, there will be a lot of mistakes that a surgeon might make, which the AI will help him understand. It will tell, no, you have not done this procedure, you have not done this step, your accuracy is not good. So AI assisted robotic surgery will help in coming out with better outcomes in a health. And another one is virtual nursing assistants. Like we can have we have nursing assistants, like you'll have people who take care of the patients, reminding them of no, this is a time to take your tablets, or this is the time for you to schedule your doctor appointments. So an AI will take care of this job. And third thing is AI assisted medical diagnosis. It's still in a very, very nascent stage. And coming to an AI assisted medical diagnosis, some of the domains are doing good, like the ECG. And any deviation in the ECG, yes, the AI is able to tell like whether it's normal or abnormal. If it's abnormal, what type of abnormality it is, what are the conditions associated with it, what are the possible diagnoses. But we are still in very nascent stages, because in order to really build an AI to make a medical diagnosis, you need a doctor who understands engineering as well. It is an engineer cannot program a medical diagnostic AI, and a doctor who understands how clinical diagnosis works will be the only person who will be able to build an AI to make a medical diagnosis. So that is the reason why it's still nascent. Another thing is medical image analysis. This is one area where the penetration is very high. So thanks to all the digitization of radiographs, MRI, CT scans, like today you take some thousands of CT scan images, and these things were actually manually analyzed by radiologists for months together, but your AI is taking very less time, probably in few hours, even to generate reports. It gives you potential markers in that images to tell, look, you put a CT brain, and your AI can pick out that appears to be a mass possible conditions. So this medical image analysis is one domain that has very good penetration. And drug discovery, yes. So what way is it helpful? Like if you go the medications that we are using, right? So instead of not doing trial and error every time, so you can use AI to go through the database and find out any possible solution for any existing problem, probably using repurpose the drug for something else. So for COVID-19, like a hydroxychloroquine or ivermectin, we repurpose those drugs. So this was done manually, but probably in future we might have, the drug discovery that is happening that is being taken care by an AI itself. And then medical data security. So one problem with medical data is it is highly confidential. Forget about some of the common diseases like diabetes or hypertension, but think about diseases like HIV, being HIV positive, or being a patient taking suicide, antidepressive drugs, patients on SSRI. So in such cases, the data that we have, we also carry the responsibility of keeping it secure. So medical data security is one aspect of AI that is robust, and automated workflow assistance is another thing, like automated digital clinician notes, right? So instead of writing the prescription on a pen and paper, you have a digital note, you have a digital pen, and you write the notes in that particular tab, and your writing gets automatically coded inside your database. And in many ways, like automated workflow assistance is helping the patient in from very basic things. Like one thing is to schedule appointments, right? Second thing, like order for drugs or order for laboratory tests. And there are many ways, and not just the patients, also helping doctors in a lot of ways. Instead of trying to remember, instead of asking their patients to carry their medical records, they just have to carry their medical ID. The medical ID you type inside the database, you get the almost all the history. So now the doctor does not carry the burden of knowing everything about the patient, or know having, if the doctor wants to know what type of treatment was given 6 months back, he can still go back to the medical records easily at a click of a button. And then the medical risk prediction. So I have a set of 100 people or 200 people, and I want to know, out of these 200 people, how many of them will be at risk of developing stroke or cancer or hypertension or maybe any cardiovascular disease. So this is one area where AI is doing good, and a lot of innovation is happening. And not just with almost all parameters are being used. Like, for example, like fundus imaging is being used to identify diabetic retinopathy. So, and it is being used to identify pre-diabetic patients just by looking at a fundus examination, right? Yes. And another thing is fraud detection. So you will find that this is more from a claims and reimbursement perspective. In the insurance sector, you'll find a lot of people forging their medical documents for personal claims. So AI will help validating the information and help avoid fraud. And finally, clinical trials, especially when you do clinical trials. So clinical trials has a lot of compliance standards. So at this point of time, any contract research organization or any pharma company, they do each and every work manually, right? Even if going back to database and checking the age, it's being done manually today. So using an AI will help automate most of the grunt work associated with clinical trials. So these are the 10 most common applications of AI in healthcare, and there are many use cases. And but what and this is not not a complete list. Like each and every day something new comes in. There are studies that are using voice as biomarkers to detect COVID-19, voice as biomarkers to determine whether the patient will develop Alzheimer. Probably they can try to detect depression, etc. So this is not an exhaustive list. Like I just given a small gist, and it tends to keep updated from time to time. But what you really need to know in healthcare is about AI in healthcare is the opportunities, the use cases of AI in healthcare is enormous. And we are still exploring, like how electricity was being explored. And when the electricity was found, they did not really know what to do with it. But then slowly people started exploring, okay, now let me create an electric bulb. Okay, now let us have an electric stove, and then you have electric trains. And today electricity, and now the evolution has gone to a totally different direction. And if you turn back and look, and the starting point was always electricity. The same way we are slowly evolving, and we have not stopped exploring. Probably 10 years from now, we will be having proper use cases. We might be having smart hospitals, or fully AI enabled hospitals. We may or we may not have, but we're still in the stages where a lot of exploration is being done. And yes, the most important part of today's talk is about, this is specifically for the medicos who are listening to it. And I think this is how we usually have the question. So that's how I also started. I'm a doctor and I want to build an AI, how to proceed. And do I really need to know coding? And if not coding, or if is coding, then what are all the skills and competencies required by a doctor to explore AI? And we all know artificial intelligence, machine learning, programming, everything is related to an engineer, right? But then when it comes to a healthcare sector, it is impossible for an engineer to look at certain aspects like a doctor, right? Like how do we really make a diagnosis of a diagnosis of malaria, or maybe a diagnosis of tuberculosis? Even how much ever we give the protocol in the hands of an engineer, it is very hard, because they don't understand the anatomy, physiology, or the biochemistry, or the pathology, or the pathophysiology behind it. So it is important that when it comes to clinical AI, it has to be built by a doctor. So in this session, in this part, we will be seeing how to start and how to proceed, what are all the skills and competencies and challenges. So if you are a doctor, and if you are trying to build an AI for any process, anything for that matter, so these are the 6 steps that you have to follow. I repeat, if you are a doctor, or if you're a medical grad, or if you're someone who comes from a non-tech background, but still you want to do some innovation with AI, please don't worry. Not knowing technology is not a limitation. These are all the steps that you need. And if you closely look at this, it's only step 4 where you need you have actually the technology coming in. And if you don't know the tech completely, you always have the freedom to collaborate with tech experts. So, but how do we really start? This is the question which I normally get from the founders of startup, especially students, medical grads. Okay, the step 1 is, please identify what problem that you want to solve and define the problem statement. It can be anything very simple. For instance, the patient have lot of waiting time outside a doctor's clinic. Is there a way to schedule appointments in such a way that the patients, instead of waiting at outside doctor's clinic, they can come exactly at the time where they're scheduled? So this is a very simple problem. So and this way you will find a lot of problems inside healthcare, only which a medical person or which only a clinician will understand. Like and most of the time, the innovation that is happening in the tech industry that's being brought by tech experts, we find that most of the things cannot really fit into the clinical domain, right? We might come out with a lot of innovation, but still the uptake by the patient is not there. And you try to build an app, but that app requires an internet, but you have to use that internet with a tribal population. You are planning to use that app with a tribal population that don't have access to a phone or internet. Then there's no point in coming out with an innovation. So if you are trying to innovate something in AI, so these are the steps. Step 1 is, please identify the problem and define the problem statement completely and very specifically. And number 2 is, please assess what are the possible solutions. See, AI is one of the solutions. Yes, agreed. But some of the times AI may not be really needed, right? Some of the times what the real problem may be very different. The patients are not turning up to the clinic, or patients are not coming on proper visits. The actual problem may be it's not being communicated properly, or the thing is maybe the solution may be very simple. The patient is looking at more human connect. Maybe the patient is looking at more empathy rather than an AI. So when you identify a problem, also assess the possible solutions. And step 3 is, you need to do a background study and feasibility study of each and every solution and check which is the best possible solution. If the best possible solution is not an AI, please don't pursue an AI. There's no point in coming out with an AI and making the people no accept it. See, there's like, no, none of us asked for a social media, right? But suddenly someone came up with the concept of social media. Then we had Orkut, then we had Facebook, now we have Instagram, Twitter. No one asked for it. Did we even think of having a social media, or did we really think of tweeting or following all these people? We were happy with newspapers. But when you look at this particular social media was innovated and then was given to the people, right? But that does not work with healthcare at all. You cannot invent a drug and then decide what disease it will cure. That doesn't work with medicine. With medicine, you should have a very clear-cut disease, then you find a drug. So the same way, if you're going to compare AI with a drug, you need to really find what is that problem that AI is going to solve. Do you really need an AI to solve this problem? If no, please ditch your AI idea here itself. Don't come up, because building an AI is cost and labor intensive, requires a lot of time and resources. But on the other hand, if you feel AI is necessary, AI will will it improve the process in the long run? Yes, then go ahead, try to build AI, the AI-based solution or a product. And when you really figure out in your mind, yes, I need an AI-based product or AI-based solution, AI-based service, that is the time when you should collaborate with tech experts. The tech experts are those like, yes, it's understood that we don't know how to do programming in Python. We don't know what platform will be really good for this. What type of programming language should we use for this? Is there any other better way to do this? So This is the point where you need to collaborate with tech people. You take your idea and give it to tech people. They will come out with your solution. And step 5 is building the product. Building the product is actually a collaborative process where you give ideas to your. There'll be two R&D team. There'll be a clinical R&D team and there'll be a technology R&D team. Clinical R&D team will give the cognitive inputs to the tech R&D team, and tech R&D will build a product and send it back to the clinical R&D team for feedback. So it goes back and forth, and finally come with the product. But the product is ready. Can I take it to the market? No. First thing, you need to verify your product. Is it really doing what you're telling it does? So you may tell that my AI detects, my AI finds out any myocardial infarction by just reading an ECG. So you really have to make sure, is it really good at reading an ECG? That's number 1. And step 2 is validating it. So you need to compare it with the gold standard. What is a gold standard? The gold standard is a cardiologist. So you compare. First thing, you verify whether your AI is really reading the ECGs. And second thing, is it reading the ECG the way you want it to read it? So that's where you validate the product. So what if your product fails this verification validation process? Then please go back to step number 4, 5, and 6. You go back again and again. That's how you'll see. So one of the most famous project is that IBM Watson. IBM Watson, still they're struggling with building a very proper AI because any AI requires data. Without proper data, no AI can survive, right? So without proper information, and just getting the data alone is not enough. The data has to be cleaned, prepared, pre-processed, and the machine has to be trained on that particular data set. And when new data set comes, then the AI will try to work with the data, and it will spend a lot of time actually trying to understand what the data is. So this is a very huge process. So we are not going into the data aspect. We are more on the functionality of AI here. So these are the 6 steps. Yes. So now, after discussing the 6 steps of being a doctor, so what are all the skills and competencies that are mandatory? Number 1, communication skills comes as the number 1 skill, because the better you communicate your ideas and your thoughts to your tech people, the stakeholders or the collaborative partners, better your product will be. So most of the time, the doctors have a lot of ideas, but they're not able to put it across. They're not able to communicate. So most of the ideas there's lost in translation. You tell something, your engineering counterpart understands something, and then there's a lot of rift, and there'll be once the product comes in, they'll say like, this is not what I said, and they don't understand. There'll be a lot of friction. So communication skills is our number 1 skill, and number 2 skill is problem solving and critical thinking skills. So you should always have a problem solving approach. So that is the most important concept of AI. AI is not a fancy thing in medicine. Probably it may be a very fancy thing in other domains like telecommunications, or maybe when you say this bike has an AI, it looks very cool. Like when you say this home is a smart home, AI enabled home, then it looks cool. But when it comes to medicine, it's not about having a fancy term associated with AI, but rather AI should solve some problem, and that problem solving skills belongs to you. So you are basically using AI to solve a problem. So you need to have problem solving and critical thinking skills. And then, yes, you must know the basics of biostats and mathematics. And you must have a very good idea about clinical data science, and including data management and data analytics. So in what way is this different from the regular data science that we keep hearing? See, when you go to regular data science, the data is straightforward. But unlike in when it comes to clinical practice, no 2 patients give the same type of data. That is a headache, right? So one patient will be giving the data on diet properly. The second patient may not be really giving the data on the diet and nutrition. So that becomes, there will be a lot of consistency, lot of fragmentation. There will be, there will be a lot of variety. Then one patient giving in data in different forms, like there will be data from their wearables, there'll be data from their lab reports, there'll be data from their clinicians notes, the nursing staff notes, and hospital stay, discharge. You just have so much of data coming out of all these medical sources, so which is completely different from the standard data science that we know in the industry. And the next thing important, yes, data analytics is mandatory, and apart from that, machine learning concepts, we must know what machine learning is, what are supervised learning, unsupervised learning, what are deep learning methods, why we are using, where we are using, how we are using. This is very important. And another important skill is research methods. It is important because most of the time when you say when you're working with an AI, you are actually doing research. You're not doing anything more than that. See, building the product, building the solution is only 10 to 20 percentage of the time, but the majority of the time actually goes off in doing research about it. And finally, coding skills. Coding, when I say coding, the Python or Java or C++, anything for that matter. Yes, though this is the level of coding required might change from one person to another depending on the requirement. But it is essential to know the basics of coding, or why a coding language is used, or how it works, or how the user interfaces are. And yes, so what are the mandatory tools to learn? Microsoft Excel tops the list. Excel is the basic tool which you should know how to work with, because Excel is the very basic tool how a relational database looks like. And you should know most of the functionalities with Excel, how to work with data in Excel, cleaning data, correcting, checking for inconsistencies, missing value, etc., etc. Microsoft Excel is the topmost tool. And the second tool is Python. Python is the most common open source tool. And third one is RStudio. And finally, SAS. See, one word upon SAS is that SAS is the standard tool used for clinical trials, because that is the format in which you submit your data for the regulatory approvals of your clinical trials and drugs. So SAS as a tool, SAS for statistics is an important analytics tool. It's a mandatory tool which a clinical data scientist should know. And yes, and another few other points to remember is what is clinical AI and how does it differ from others? Like I said, when it comes to let us say you have an AI on Facebook, maybe you have an AI on your cab aggregator apps. You don't require a taxi driver to build that. You just tech people are enough. But when it comes to clinical AI, the person who is building the AI should know both clinics as well as artificial intelligence. So that is a major challenge, because you know that most of the doctors, they are outside this programming stuff, they are outside this tech stuff, right? So that is very important. Only a clinician who understands how the clinical things work, clinical significance of clinical stuff works. Because when you come to let us say when you come to clinical data science or machine learning or artificial intelligence, there are some 1,000 patients, and of cancer 2 people died of cancer. Okay, so the AI will take these 2 people as insignificant, because 2 out of 998,000 is not a big number. But for an oncosurgeon or an oncologist, this 2 is a significant number, right? 2 stage 4 patients died of cancer is very significant. So this way, you need a lot of clinical knowledge while working with clinical AI. So now what are the challenges and opportunities? First thing is that you have a lot of opportunities, but the challenge, like I have been consistently repeating, is that there are a lot of opportunities, but we don't have the right people who can form a bridge between the tech people and the clinical people. So the whatever tech people are trying to do, clinical people don't understand. What clinical people want, tech people don't understand. So you have so much of the wavelength differs between these 2 groups. And finally, the push versus pull approach. Like I told you before, a clinical AI is not like social media, like you invent and make the people accept it. Like it's a reverse. The people themselves should feel the need, and that should be a definite need, and then you innovate it. So that's what the push and pull approach. So the social media that we have is a typical push approach. Someone invented social media and it was pushed to the people and we're using it. But when it comes to clinical AI, it's more of a pull approach. We need to really have a definite need before starting with AI. And that brings us to the end of the session, and I'm open for questions.
That was such a spellbinding session. The past hour has been amazing. The use of machine learning algorithms and software to make human cognition in the analysis, presentation, and comprehension of complex medical and healthcare data promises to be a game changer. This has allowed those in training to go through naturalistic simulations in a way that simple computer-driven algorithms cannot. The advent of natural speech and the ability of an AI computer to draw instantly on a large database of scenarios means the response to question, decisions, or advice from a trainee is now unlike ever before. I am eagerly looking forward to explore more about everything that you just said, sir. Meanwhile, sir, we do have some questions from our participants. What is the danger of AI making the wrong decision, and who is responsible when those decisions are made?
Okay, so like I said, you cannot leave an AI on its own. So AI is like a baby. So you can't allow the way you cannot allow a kid inside a kitchen, the same way you cannot allow an AI to make these clinical decisions. But yes, AI can be a good assistant toward an expert clinician. Like it will help fetch documents, or maybe whatever that an expert clinician is not able to bring his to his memory, he can use an AI. Like he can use an AI to pull out information from the textbooks. Maybe he can read latest news articles. So to answer that question, one thing, you can never leave an AI on its own. How much ever accurate an AI is, it always requires a doctor by its side to validate its decision. So, which means an AI is never going to be alone.
Thank you, sir.
Yes.
So coming to the next question, there's been another question. Someone is asking, what is the potential for the malicious use of artificial intelligence?
Okay, so like artificial intelligence involves data directly. So data theft and loss of identity is a huge problem, especially when it comes to very sensitive healthcare data, like data on infectious diseases like HIV positivity, or there are chances like people find out who that person is and then go blackmailing that person. So there are risks. So this is one major risk which has to be sorted out, and that is one of the reasons also why AI has not been able to penetrate much. For instance, we are all happy giving out our the user data on Swiggy or Zomato. We are not bothered. What will anyone do with the data knowing that I had this burger or sandwich someday? But that is not the case with medical data. If I'm having antidepressive medications and someone comes to know of it, all these things are very crucial information. So data theft is a major issue which needs to be sorted out.
Thank you, sir. There is another question saying, what promising advancements do you see in the point of care treatments?
Okay, so yeah, like I said, a few things you can do. One thing is improving the accuracy of treatment. The diagnostic efficiency can be improved, and finally, the time factor involved. Like saving time for the patients as well as the doctors is one thing that you can do with AI. And another important thing is, when you take all these things collectively, at the end of the day, you translate everything into a financial cost. So a lot of things, it will avoid duplication, and it will avoid a lot of redoing stuff. It will save time, which also means it will save a lot of money as well. So yeah, from a financial perspective, it is of very great use, and also from a therapeutic perspective.
Thank you, sir, for answering that. There's been a question that, are there any guidelines as to when virtual care is more appropriate and when face-to-face is a better option?
Guidelines as such, you are asking for government instituted guidelines, or is it non-government instituted?
Sir, the question didn't mention, so I guess both, any of them.
Okay. So when it comes to provide, okay, so now this is actually not AI, it's more of telemedicine. So they're trying to understand what are all the guidelines. So before COVID, telemedicine had limited users and limited functionality. And but then after COVID, like telemedicine is being equally used like any other face-to-face interaction. And yes, there are different guidelines for both, and especially in terms of data privacy, data confidentiality, security, and another ethics perspective. So how ethical is it to really diagnose a patient without even doing the basic procedures in clinics like observation, palpation, percussion? Like if you look at this, except for when you are having telemedicine, you're basically observing it, but even that observation is not 100% accurate. So in actual clinical practice, you are palpating, percussing, doing percussion and auscultation. And so there the guidelines actually differ for each of these, and different societies have different guidelines. Like there is one common guidelines for the entire healthcare sector issued by the government, Ministry of Health and Family Welfare. And also there are separate societies. For gynecologists, they have their own guidelines, and surgical gastroenterology, they have their own guidelines. Surgeons, they have their own guidelines. Cardiologists have their own guidelines. So they know what are all these trends, and till where you can use telemedicine and where that thing stops and where the actual physician comes into play. So different domain, there is one common overarching guidelines, but there are also domain specific guidelines.
Thank you, sir. There's one more question. Who is going to bring about the most changes in healthcare? Do you think it will start with small startups, or with new technologies, or someone like Google or Amazon, or the larger ones?
Okay, so there are few both advantages, disadvantages. When you look at startups, they have high level of innovative thinking, because they are not bound by a process. They are free to think in any direction. But the problem is they're restricted by resources. So, but then when you take bigger companies, they have enormous amount of resources, but they're all bound by process, right? So you don't have someone working with your Amazon or Google for a very long period. You'll find them an engineer with Google for 5 years, then he'll be in Amazon for another 5 years, then Facebook for 5 years. Then after 6 years, he'll be starting his own startup and he'll be out of all these things. So you test the both pros and cons. But ideally what happens is all these people who work with tech majors, they come out, have their startups, build products, sell it back to the tech majors, and the tech majors actually do the marketing part. Because marketing part is something that is very different, which a startup cannot invest time and resources on. So that's how it usually works. So innovation has to happen both ways. That's the reason you'll find all these tech majors, they are more involved in acquiring startups for millions of dollars, even if the startup doesn't work well, but still for the data that they collect, they acquire it. Yes.
Yes, thank you for those wonderful answers, sir. We have some more questions. One is, how can AI help in reducing patient load, which is a major issue in India?
Okay, so one thing is, like I already told you, there are patients. If you take patients per se, you will find patients who do not require the actual clinician's appointment. So what they need is more of a counseling or maybe some care and support, but actually not a physician's intervention. So that is one thing. So second thing is, there are also patients who will be requiring the clinician's intervention, but not on high priority, right? They can wait, right? Diagnosed with diabetes, it's not a medical emergency. But you see, let us say you have a cardiovascular disease or maybe a stroke, it's a medical emergency. So now your AI will help to do few things. Number one, it will help to identify this high priority patients and order people and schedule people based on the priority, number one. And number two, there are places where even if you go and meet the physician will just tell that you're all right. You just don't have any problem. You, like, whatever, all the reports are normal. So AI can play a major role in picking out all these things which are actually normal, doesn't require clinician's intervention, so that the clinician can save time seeing the patients who really need them. So from a public health center perspective, so you have some 200 patients coming into the public health center, you'll find them, all of them lined in the same queue. But now let us say you have prioritized and you have scheduled them accordingly, and some manual laborer working for some company, he can schedule and he can come for that particular time slot, and then he can come visit, take medicines and go away. And you'll also find people who on chronic medication, they'll have to spend one full day, and if you're manual laborer, you lose those daily wages. So AI will play a major role in all these things.
Yes, thank you, sir. I hope that was clear to the audience. Then next question is, what course should we pursue after MBBS for AI? And also on a similar ground, there are a bunch of courses on Coursera. Which to start and when to start?
Okay, so coming to the courses on Coursera, yeah, see, there's no right time to start, because today you'll find school kids, 7th or 8th standard, they're doing coding really well. They understand data science, AI, everything. So if you have not started, please start right away. It's very important. But like I said, if you're targeting clinical AI, more than AI, you should be clinically sound. So you should understand, if you are going to make a decision of a stage 3 cancer of breast, right? So it is essential to understand what are all the components that goes into making this diagnosis. So then you take this to the engineering aspect. So what you really need, 90% of the knowledge is actually clinical and 10% is tech based. So just make sure, if you are a college student, you can start learning some course on Coursera on weekends. So if you are a full-time, if you are a proper medical doctor, I would suggest not to go for any full-time courses that being offered by private institutions for 4 or 5 lakhs for the entire course. Please don't take it, because you will never use most of the things, right? Even if you get employed as a data scientist, you'll be a clinical data scientist. There'll be another data scientist who comes from engineering background. He will be taking up the job. So your job is more on the clinical aspect. So it's much better that you focus on the clinical aspect and less on the tech aspect. And there are courses. There is a course in IIT Kharagpur called MMST. So that is one course that is good enough. Like you learn a lot of stuff. And probably today you are having courses. So if you are not someone who's going through a very structured way of learning, then it's better you can have your design, customize your own learning program and start learning using online resources. So my point is this: anything and everything will work, but ultimately what really works is that your problem solving skills and your clinical skills, and trying to apply, see what are all the areas where AI can fit in. So that is the most important thing.
Yes, thank you, sir. Another question is it essential for a medico to know Python? Any simple way to use AI for medico?
Okay, so talking about Python and other programming languages, we are slowly moving towards a point where you no longer require coding, right? When I started learning coding, it was long back, and we actually had to learn coding line by line, word by word. But today, most of the Python interfaces, especially the Google Collaboratory, Google Colab, and they have an automated process of, all you need is a source code and you can just make changes. So we are slowly moving toward, yes, you need to know the basics of coding. You should know what libraries are. You should know what a particular line mean and why we are using certain punctuation, why there's a space, and why we are writing this statement, why we are calling this function. This information is essential, but we are slowly moving towards a point where this can be automated. So we are going to a level where you can be a programmer who doesn't know coding, right? Where most of the things are automated. So if you are targeting the industry for after 5 years, then probably you will not require coding at all. We are slowly reduce the need for coding. So coding as such is not, yes, it's important for engineers, but for a doctor, not as much as it is important for an engineer. But you should know the basics, yes. Basics, you should know as much as you can. Talk to an engineer about Python. If an engineer talks to you about some library, you should know what that library is, what it means, etc.
Yes, sir. Next question is, how can we expand robotic surgery and telemedicine in Indian rural areas?
Okay, so one thing what we require is we need the government's intervention, because like you say, rural and tribal areas, say when you say robotics or AI, it involves cost, and most of the tribal or rural people cannot afford this. So one thing, you need assistance, you need a social entrepreneurship model, or you need government's intervention. That's point number one. Point number one, you also have to gain the trust of these people. Unlike the cities where any tech gets absorbed easily, it takes a lot of time for the tech to penetrate rural and tribal areas. So gaining the trust of the people is another important thing. And third thing is finding out local players who can create your tech indigenously. So I'll give you a best example. So if you are trying to build a product, and where all your raw materials are being imported from Europe, then the cost of the product goes to 70,000. Obviously, no one, you cannot find people in India trying to buy one simple medical device for 70,000 until unless it is a life-saving device, right? Otherwise, people won't use it, right? So let us say it is indigenously made for like 10,000 or 15,000. Then when the cost comes down, then the uptake, the chances of being bought is also a little higher. So these are all the factors.
Yes, sir. Thank you for that. Sir, if you could share with us, we would love to know how was your journey and what drew you in this field of AI.
Okay, so I did my medicine in Stanley Medical College, and I had intense interest in technology and AI. And to start with, I started working with statistics, and I started working with a lot of data. But I started working more with text-based data. I was more of a neuroscientist, where I was working on theory on how languages are programmed in the brain, for which I created a simulation. So for which I had to learn natural language processing in Python. And just after having learned that, then I also learned the other skills required in data analytics. And all these things happened before data science was actually a name or a trend in the industry. So, and right after that, suddenly the need came in, where they started looking for doctors who understand programming. So it's not that even if you know programming really well, you will never be allowed to do programming word by line, because you will have developers always. You'll have a lot of engineers to work with you, but what do you really instruct the engineer is the biggest question. So my job today is more like, I design the architecture, I tell them this is what I want, this is the input, this is the output I want, but the execution part is always left to the tech R&D team. So yeah, it's been a journey. It was not pre-planned. It happened step by step, and it just evolved.
Thank you so much, sir, for sharing that. And yes, we have one last question that we would take. Any idea or plan if we have for AI, whom can we approach to execute that plan?
Okay, so if you have an AI, you'll have one thing is depending on what type of solution you have. Like even with deep medicine labs, like we are incubating ideas. Like we have students who bring their ideas, we incubate those ideas, we help the students build proof of concepts. So that is one possibility, and there are a lot of technology business incubators across India, and you can also incubate your ideas there, and they will help you build your proof of concept. And what I would suggest is, like, you have before uh, coming up with an idea, just do a proper feasibility study and background study. If any student comes up with an idea, we just don't get carried away by the idea. We ask for the feasibility study report, or maybe we ask them for the background study report. I want to really know the particular problem that they're trying to solve, the particular solution. It does not already exist in the market. That's a major deciding factor. So yeah, that is one thing. You have a lot of technology business incubators, a lot of colleges has it, universities has it, and you have angel investors, venture capitalists. If your idea is good enough, if you have a very solid product, you will find a lot of people coming to invest. And if you are someone having an idea in the pre-incubation stage, you can approach us, and we'll help you incubate and develop your proof of concept.
Thank you so much, sir, for answering all our questions so well. Unfortunately, sir, that is all the time we have for today. Though there have been plenty of questions by our participants, we would not be able to take them due to time constraints. We are truly thankful to you, sir, for your precious time and for sharing your knowledge with us. The session has brought us enough enlightenment on the importance of AI in the medical field and even as a whole. AI has become an integrated part of our lives without even trying much in that direction. And getting to know more about it has only been a boon to each one of us here. We are also grateful to the organizing members of the conclave for putting in such an informative session during our days of hustle. We would also like to thank Dr. Shubham Anand, who has been the driving force behind all these informative webinars conducted by GAIMS. And to our audience, thank you so much, everyone, for joining in. Take care and stay safe. Thank you.
Yeah, thank you all. Good night.
Yes.